This is Ty Newell with COVID status report number 22, window of opportunity, posted July 27th, 2020. We skipped last week as we were traveling, and we'll talk a little bit about traveling and how to do it safely, or at least as we think we did safely. But as we're getting tested this week, so far, so good. Everyone's been negative. Before we went on the trip, I got tested just to see that I wasn't infectious and spreading stuff along the way, and it was negative. Um, you can see I somewhat surprised the person testing me. Apparently, people don't quite react like that, or as well as take a selfie while they're being tested. And our family did a great job masking. Here you can see four of us on our way out of a car to uh, to go to the bathroom. CO2 measurements along the way, good, bad, and the ugly. In the car, something for you to know is that when you don't use recirc mode, here's 1,770 parts per million. And even though the three of us, have been in our own bubble during the disease, so elevated CO2 is not bad from the standpoint of COVID transmission, but it is bad as far as driving. And I can tell you, I need as much brain activity as possible to competently drive. When the car is put in fresh air mode rather than recirc mode, look at the difference. And this is just minutes. Drive with fresh air. Your brain will function better. Stopping for takeout at a barbecue place. We phoned in our order while we were driving, stopped. I ran in and got it, had my meter with me. This is okay. This is this is ASHRAE standard ventilation, 62.1. So this is what you typically see in a building. But that means it's about half of the fresh air flow that you get when you're at 800 parts per million. Here's a bagel shop, and it was a busy shop. It doesn't look that busy here, but there were a number of people coming in to pick up orders, and it just stayed pinned at 800 or a bit less. And so they were doing a great job. Hotel we stayed at, again, okay, in the lobby. In the morning and waking up, basically this high level, which is not untypical for bedrooms in homes without fresh air ventilation, but this means a poor night's sleep. I mean, there's tests that just show you don't get a good night's sleep, even though you think of elevated CO2 as making you sleepy when you're driving. The main problem in driving is brain function. This gives you a poor night's sleep, and you perform poorly the next day when CO2 levels are getting up above, say, 1,500, 2,000 parts per million. And this convenience shop, as we were gassing up, ran in, got some licorice, and it was surprisingly good. I don't know if it had a fresh air system or just it was decrepit enough that it had a lot of leaks, but I was pleased to see it looking so good in there. The house we stayed in, the bedroom in the morning, typical of bedrooms in, again, homes without fresh air, that it not unreasonably high, but higher than what you really want for good night's sleep, for making it so that if whoever may be sharing a bedroom with you is sick, that you have less likelihood of getting sick. And then lots and lots of fresh air. We were basically outside on the beach, on boats, on the porch the whole time. Didn't go to any restaurants, but we had no need to. We were having fun cooking out and enjoying each other. The past 2 weeks, I haven't shown this plot in a while. I started it way back here at the end of March. And then I made these predictions on it and said, well, if we can, even though Europe and other places got serious and turned the tide of this at about 200,000, 300,000 infections, that, well, if we could hit this infection parameter of 2 like they did, but belatedly, maybe we could follow this path. A path of 3 for the infection parameter is somewhat curving up, And as we've said, and we'll talk a bit more about, 2.7 is a straight line, and it's a dividing line between infection growth, curving up, and infection decay, curving down. We've taken this unfortunate turn over the past month, a predictable turn, one that should have been avoided. And the only reason we've kept it from skyrocketing, say, along this path, is that citizens are taking actions to reduce the impact of careless reopenings. People are getting more and more serious around the country. And we have a window of opportunity right now to try to get this back over in this range and try to get it to start dropping down. And it's important to try to do that now, because we're going to have a second window of opportunity that will kick in as the country, much of the country, starts dropping below 70 degrees. This temperature effect we discussed last time. Now, when this happens, the 70 degree, as we get into that 50 to 70 degree range, and we see infections drop because people are opening windows again, they're getting outside more, buildings are increasing their ventilation levels, we're going to see infections drop, and we don't want to get lulled into thinking we've won, because just as soon as we do, the country, much of the country, will start going below 50, and there'll be an equal and opposite jump back up in infection parameter. And so we have to watch this, and we need to stay on top of it, even though it might seem we've won. And finally, I'm going to keep mentioning ad nauseum, as much as others are saying how well they've done, how responsible they've been, how they've done better than anyone else could have. That is such BS. We have done a horrendous job. This is predictable from a long time ago, where we're heading and why we're heading there. And it's totally because it started at the top with confusing, contradictory, ambiguous, inflammatory messaging and outright lies. And that's the difference between if we had taken this somewhat less horrendous path, that we had plenty of time by the time we got to May to get on this path, but didn't, kept following this path. And then the surprise of poor reopening activities coupled with the temperature impact, that were a good 3 million infections and associated fatalities above that. And there's people directly responsible for that. And we must not let them rewrite history and turn themselves into heroes. And if this series of reports is worth anything, I'm hoping it, at least in real time, is documenting this pandemic and provides others in the future a way to go through and sort what the hell happened. Why were we so friggin' horrible at managing this crisis? Just briefly on this modeling that I've been doing, just so it's not like pulling it out of my ass or out of thin air like the federal government has been doing. There's a basic model. There's a bit more mathematics to it than this, but this is all the mathematics say, is that the rate of infection growth is equal to this infection parameter we've talked about times the number of infections, infectious persons. A person's infectious for about a 2-week window. And we're doing horrendous because of both of these. We have a horrendous number of infectious persons, about 2 million right now. And this parameter is above 2.7, where we accelerate the growth of infections. We have control over this. We just have to ride the storm until people are out of the infectious period. But this number has to drop below 2.7. And it's based on two primary effects: a social distance index, as we've talked about, that I obtained from the University of Maryland, something based on GPS data from cell phones and vehicles, anonymous data. And normally we're at about 20. 0 is total interaction versus 100 perfect isolation. We got up to about 60 when we totally shut ourselves in March and April. And we've since moved back to about 32. Um, and then this transmission efficiency parameter that I call G is the other important ingredient. When we were at normal interactions among each other, shaking hands, hugging, singing in groups, and all of these things, the transmission efficiency is 1. Currently, we're somewhere around zero point 0.1 to zero point 0.2. The temperature effect took us from about zero point 0.1 to about zero point 0.2, and that was enough to jump us over the infection parameter level of 2.7, where many areas that were managing things properly started to see some acceleration in infection cases. So our overall goal, we've got to get this infection parameter below 2.72, and that's a combination of higher social distance indexes and lower transmission efficiency. And if you'd like a bit more formal reading of this model, as well as this temperature effect, I posted it on this thing called medRxiv, medRxiv. And if you just search Ty Newell and medRxiv, or you can use the citation number here. Now, this is a non-peer-reviewed pre-publication posting of it. And so you can grab that. And if this presentation isn't enough to put you to sleep, surely this paper will knock you out. So over the past 2 weeks, the trend in infection parameter for the US, it skyrocketed here, where I had predicted at the end of June that the US was going to go into this positive territory just by this trend. But then it took this unexpected jump. And as I found, it correlated very strongly with the 70-degree temperature. Just as there was a drop over here that has, in addition to the country shutting down, also a temperature effect as we went above 50. And this decrease now over the past 2 weeks since we've been gone, this has been from a concerted effort among people to a little bit of increase of the social distance index, but then more recently, a good drop in the transmission efficiency, indicating more people getting serious about wearing face masks and distancing and understanding that this is impacting everyone. This other view of the infection parameter, again for the US, but now showing how it relates to the social distance index. And in May, as we were starting to reopen, we were working our way down in social distance index down to a level about 29 as a whole for the US. And also getting more and more people to wear masks, to take distancing and sanitation, and doing other things, hopefully increasing ventilation, to be able to move to lower social distance indices while also dropping down to, at this point, about a transmission efficiency of 0.1. And then as we were at this level of social distance index, we saw this skyrocketing of transmission efficiency parameter to about 0.2. And then as the news reports started coming in, as we did this leap above 2.7, where the linear growth, the constant number of cases per day wasn't quite so horrifying, so we weren't being too serious about it. But as you get to this infection parameter of 4, the news reports became quite horrifying, and people started to social distance on their own. Again, no direction or coordination from above. And then we've somewhat stagnated at a social distance index of about 32 or 33. And as we saw on the trip, moving through states like Kentucky, Tennessee, South Carolina, Stops along the way. People were wearing masks. People were wearing masks in the bagel shop, in the barbecue uh, takeout. So people are getting serious about it, and this has gotten us down not to where we need to be, but a significant improvement over where we had been. I showed this plot 2 weeks ago, and this prediction model that I've developed based on the social distance index and transmission efficiency. I originally showed a sharp increase, a bit sharper than what this is showing now as I tuned it with more recent data. But in June showed that we were going to be heading up. And that's because the infections today happened more than a week ago, the incubation period. And actually, sometime over the previous 2 weeks, the infectious period for a person. And so I then, as it started getting some direction on what we were doing with social distance index and the transmission efficiency, could see us moving along this path, but also somewhat of an inflection that we should be moving along this path with where 2 weeks ago I saw the social distance index go. Looked like we'd be somewhere around 33 and 0.19. And so here's today's plot. No changes to it other than adding this data. And you can see that it is basically going along here, a bit of noise in the way this data gets reported, but still basically saying that this is a pretty damn good prediction model. Now, the movement is somewhat of a lower social distance index, which increases infection parameter, but somewhat lower transmission efficiency, which decreases infection parameter, compared to where I had assumed about 33 for social distance and 0.19 for transmission efficiency. And this path is the path we would have taken without the temperature bump and had essentially stayed in that swing season 50 to 70 degree range with a lower infection transmission efficiency. And with that, by September, we could snuff this thing out. Unfortunately, we're on this path. And as we've gotten some control, but still not where we need to be, I think we might be able to follow this, or at least something in between here, rather than continuing up this path. And this path basically assumes that we're operating along this infection parameter, somewhat of about 3, and that then sometime in September, the US as a whole would cool down enough where we'd get the temperature effect and be able to drop. This was that temperature effect that I showed last time. And just briefly, when New York was below 50 degrees, it had a higher infection parameter. And then as it hit 50, there was a pretty sharp drop in infection parameter. As we came through this swing season temperature window of 50 to 70, and as people started going indoors for air conditioning, New York's infection parameter came up. Not as much as other places like Ohio, which, as it went through its spring weather and then finally moved into the swing season window of 50 to 70, it had this sharp drop of infection parameter, moved along, and as it came out the other side with a bit above 70, a sharp jump up, and they've been struggling to keep control of it now, as many other places up north have now, similar to the south. And as I mentioned, ironically, 1918, the lack of air conditioning drove people outside, opened buildings up as much as they could possibly open, and also contributed to decaying the disease, on top of what's been speculated that the 1918 flu pandemic virus is also temperature sensitive and less prone to surviving warmer temperatures. SARS-CoV-2 has not shown that temperature weakness, at least that I'm aware of. And so the summer temperatures driving people inside to seek air conditioning had exactly the opposite effect in accelerating the disease. And once we go back through that window in the fall, we have to be careful that We're going to get an initial drop as it gets between the 50 to 70 degree range through the country. And then for maybe 1 to 2 months, maybe a little bit of relief, but we need to be prepared because as we go below 50, it's going to come back up. Now, here's 250 locations, and it's not meant to be readable, but basically, the yellow shows you for different locations, and these are alphabetical. So, starting with Alaska, and over here is Hawaii, and then the I states, Iowa, Indiana, Illinois, but 50 and less. And these are 2 week periods. So, first part of January, second part of January, first part of February, second part of February. Yellow is when temperatures are on average below 50. Green is when they're below between 50 and 70. And red is when they're above 70. And so you can see in the Midwest, around September, October, we're going to get about a 2 month period with temperatures in that window that will help us fight COVID. But again, we need to fight it right now to dampen it, to then have this added boost, not lay back and then let this boost happen. Because as soon as we emerge from that window and get into this and seal ourselves in our homes and buildings for heating, it's going to jump back up. And in the meantime, you need to keep harping to people to get the ventilation up, the fresh air up, the filtration up, and hopefully sanitize it. And here's just some other sites, but you can look this data up on your own on many sites for your particular location to see when this might happen. I just thought it was kind of a pretty pattern to look at too. So we are making progress. No thanks to those above, but you are making the progress. More people are getting serious about wearing the mask, staying distance, at the same time being able to interact, going outside, enjoying the great outdoors. Here, Melissa's hauling in a monster cobia. Get out and enjoy that. The more you're outside, the less CO2 and contagion there is inside. Just don't crowd around each other. Stay apart. Stay in your bubble with your friends that you know. So, are you willing to go into a building without knowing the CO2? It's like playing Russian roulette. Don't take the chance. Don't go in the building or get a meter. Upcoming reports. I want to look more specifically at different states in a more detailed manner to indicate where they're going and how the weather may impact them and the trends that they're seeing. Maybe one per week because it takes a bit to do each state. And then some special cases, for example, houses of worship as they're reopening. They're special because whether it's a church, temple, a mosque, of various sorts, that one day a week or 2 days a week, there's a lot of activity and perhaps most likely not enough fresh air. And we'll look at some data from a church so you get an idea what's going on, but hopefully generate some ideas and some discussion for places of worship to open. It impacts us all. We need everybody, wherever they're going, to be safe. Again, our guidelines: increase fresh air. Don't take anyone's word for it. Measure it, trust and verify. Better filtration, sanitation, and thank essential workers and medical staff. 4 to 5 months now of this exertion of straining our resources and our personnel. Thank you very much. Let us know what we can do.